Okay, so our next app looks at heart failure readmission costs. And to give you just an idea of how much this costs the federal government, it's currently about $17 billion in associated costs that are tied to heart failure readmissions. And what this next company, ARTO, does is create a pretty fascinating risk stratification model. They're a bunch of pure data scientists and engineers who have taken this and pretty much created a new risk stratification model, as well as the costs that are tied and associated to it. So they're part of a company called CliniCast. I'd like to introduce Krates and John Challis. Let's give him a hand.
Hi, I'm Jack Challis. I'm co-founder of CliniCast, and this is Krates, my co-founder. CliniCast builds analytical tools to help healthcare organizations improve outcomes and reduce costs. And today I'd like to talk about ARTO, our tool to help drive smarter population management. So let's say you have a general population of patients. In that patients, you have patients who are perfectly healthy, which we've shown in green, who have multiple chronic diseases, shown in red, and a spectrum in between. The challenge of smart population management is how can I find in my patients that small segment of the population that actually is responsible for cost? What can I do for that population, and how can I be smarter about it? So what we do at CliniCast is we help you find that small fraction of the population that is both high risk and has high opportunity to reduce cost. You might imagine that you can imagine a very high-risk population, like patients with stage 4 breast cancer. They're getting regular radiation treatments, regular chemotherapy. They are a very well-treated population. There is not much that, say, a home visit or nurse phone call will add to their care. Whereas a patient that had a heart attack 2 years ago and has stopped taking his medications, there is significant opportunity to reduce heart outcomes. So what does ARTO do? ARTO empowers case managers. That is our focus market. We believe that case managers are the key tool to drive better information. We draw our data from chart, from clinical data, from claims, and from medications to drive actionable insights specifically for the case manager. So the case manager can manage her population in a smarter method so that each patient gets the appropriate intervention at the appropriate time. So let's go into a demo of our ARTO solution. So when you look at a set of patients, you want to see who is the highest priority patient for a given case manager. What among my patients, who is the highest priority? Who should I spend the most time on? Who has the greatest opportunity to drive better value? If you've ever been a salesman, you know that your best opportunity is to focus on your high revenue, high opportunity clients. And if you spend a lot of time on the low yield clients, you're going to waste a lot of money. Same thing's true for case managers. So we see the patient at the top. It's a 69-year-old male who we believe could benefit from a monthly home visit. He could receive significant risk reduction. The case manager can click on the tool and see what is the patient's risk profile, what is the interventions, the potential savings, and the conditions that we drew from their own electronic medical data to get a better idea of what the case manager could derive. The goal here is to get all of the information onto one slide that a case manager needs to make a better informed decision. So let's say that the case manager calls this gentleman and he agrees to home visit. We can enroll them and have better task optimization. So that's for the case manager. Now let's say you're a manager of a team of case managers and you want to measure your performance. Well, what ARTO enables you to do is view it from the perspective of how am I achieving performance? What kind of performance can I drive? So here we plot out the total number of interventions executed by the team month to month. For those of you with a sales background, this looks a lot like number of sales calls and number of client interactions. We then want to see what is the estimated savings that our team has driven. One of the key roles of the case manager in a payer or ACO is to drive lower costs among the patient population. We are able to take in this data and determine what is the best opportunity to avert events and reduce costs. Let's look at admissions. So some organizations are more cost-driven, some organizations are more outcome-driven, and others are more balanced. We help organizations figure out what's the right performance metric given what their protocols and their goals, and we help drive that organization towards those goals. So let's say you're a case manager and you want to see how is my team performing at the individual level. Who is my star performer and who is my dog performer? How can I help my team be more effective? We see in this limit that the person on the far left, Margaret, is very effective at averting events and reducing costs, whereas Novella on the right struggles to achieve similar numbers. An interesting thing for a team manager to observe is that a case manager like Lucy seems better at driving more savings and more interventions per intervention than, say, Jenny or Donna, who do a similar number of interventions. That's a very interesting piece of insight for a manager to work with. Another piece that ARTO can help with is evaluating the effectiveness of interventions. Here we rank interventions of home visit, nurse phone call, and PCP visit, and determine what are the realized savings associated with each of these interventions. How effective are home visits in actually reducing cost? And finally, it's very important to us that our tool be able to be measured. How much savings are you actually driving in the organization? So here we point out the number of admissions with our expected baseline and the observed baseline. In a control arm and intervention arm, an expected baseline and an observed difference. On the left, it's a validation of the strength of our risk calculators. Are we able to estimate the baseline risk appropriately? On the right, that green bar is the amount of value ARTO is delivering through smarter case management. That's our demo. I'd like to go back and just give a quick recap. So just to give a quick recap, if you want to remember 3 things about ARTO, ARTO drives smarter population management. ARTO makes case managers more effective, boosting the yield in terms of outcomes and costs. And above all, it is a tool to organize a case management team around better outcomes and better costs. Thank you. If you'd like to know more, we're in the booth 34 at the Expo. We have some more information on our website, and you can always feel free to email or call us. Thank you. Thanks. Questions? Okay. It's a pleasure.
Hearing none. Thanks very much.